Hi, I'm Shell Banks and I work here at Blackpool Teaching Hospitals. I'm part of the Lancashire and South Cumbria Infant Feeding Network, and we've just got a few bits of information for you about feeding your baby and thinking about feeding your baby during this crisis time. For families expecting their babies soon, it's never been more important than it is right now to understand the importance of prolonged skin-to-skin contact after baby's born, no matter how baby is born and no matter how baby's going to be fed. It helps the baby's heart rate, it helps the baby regulate their temperature and their breathing, gives them better immunity to fight viruses, and calms mum and baby down as well. It's also good to consider optimal cord clamping. Waiting for the cord to go white before clamping the cord gives the baby the much needed blood from placenta into the baby. Every baby could benefit from their mother's first milk, known as colostrum. It can be expressed antenatally and stored near the end of your pregnancy and given to baby. Do ask your midwife for more information about any of these things when you speak to them. Babies who are breastfed have more protection from infection. All breast milk is valuable. Every drop really does count. For more information, do see our website or the leaflet you've been given called Off to the Best Start. And also remember, you can speak to your midwife or health visitor about this, or to one of the peer supporters from Families and Babies. More details about those in a minute. For families who are formula feeding, it's really important to understand that you need only to feed them first stage milk for the whole of their 12 months. So if you can't access the milk that they are routinely, typically having at home, because there's shortages in the shops or because you haven't been able to get to your usual shops, then some of the following tips might help you. First of all, please never water down your baby's milk to make it last longer or to keep it more than 2 hours after baby started drinking it. Never give baby cow's milk, goat's milk or plant's milk as their main drink, as it actually can cause damage to their digestive system. We shouldn't be giving follow-on milk to babies under 6 months, but actually babies over 6 months don't need follow-on milk either. You can actually change between brands of first infant milk. They all have to meet the same strict rules on composition. Try to only make up as much milk as you need and do paced feeding responsively to the baby's needs. And if there's a real shortage, you can ask friends or neighbours if they have any first milk they can lend to you, or you can call a local pharmacy and ask them to order it in. They can usually get it in for the next day, and if you have real problems, do speak to your health visitor who might be able to phone around and help you source some. Of course, it would be advantageous for babies to be breastfed, but if they can't be breastfed, then the only milk appropriate is first stage infant formula. Currently, the Well Baby clinics aren't running, which means no access to scales to weigh your baby. So we've produced a document with some information about how to figure out whether baby is developing and growing normally, and 3 top signs to check on to tell that baby is still gaining weight. There's more information on this through the link at the bottom of this graphic. If you want infant feeding support whilst you're in isolation, the Families and Babies peer support organisation, who've been commissioned to provide breastfeeding support across Lancashire by Lancashire County Council, have actually extended their services to cover the whole of our region, including Blackpool and South Cumbria and Blackburn with Darwin, and are happy to support both breast and formula feeding babies. Do give them a call, do go onto their private Facebook group, and remember that they have a video group running every morning, Monday to Friday from 10 till 10:30 with trained peer supporters and other mums. If there are any problems, they can signpost you back into the appropriate services, and they can make sure that any problems are triaged up to somebody more specialist if you've got a real need. Thanks for watching, stay safe, and please do ask us if you've got any questions at all. Get in touch with the peer supporters, your midwife or your health visitor.